Recent research shows that nearly half of men over 60 struggle with erectile dysfunction. What most people don't realize is that many cases can be improved or even reversed naturally, without harsh medications or risky procedures. Today, I'll reveal specific natural oils that research shows can support blood flow, balance hormones, reduce inflammation, and improve erectile function. These aren't gimmicks. They're real, science-backed approaches that I share with patients every day. You'll also learn how these oils work inside your body, how to use them safely, and the simple lifestyle changes that can make a huge difference. And most importantly, I'll explain when erectile dysfunction could be warning you about serious hidden health problems you should never ignore. Make sure you watch until the very end, because the first oil we'll discuss may surprise you. And for many men, it's the one that has the greatest long-term benefit. Before we start, write your city in the comments. I want to know where everyone is watching from. And if you find value in today's video, please like and subscribe to Glowing Age. It helps me create more practical lessons to support your health, confidence, and independence. Let's get started. Understanding erectile dysfunction after 60. Have you ever wondered why something that once felt so natural now feels frustratingly out of reach? You're not alone. Every year, millions of men over 60 find themselves struggling with erectile dysfunction. Not because they've done something wrong, but because of what's happening inside the body as we age. Let's start with the most important truth. Erections depend entirely on healthy blood flow. The moment sexual arousal begins, the brain sends signals down the spinal cord, triggering the release of nitric oxide in the blood vessels of the penis. Nitric oxide is like nature's own vasodilator, relaxing the smooth muscles and allowing blood to fill the chambers, creating an erection. But as we age, this entire process becomes more fragile. Over time, the lining of our blood vessels, what we call the endothelium, starts to weaken. Years of exposure to factors like high blood pressure, cholesterol, smoking, and even subtle inflammation slowly damage these delicate tissues. This damage reduces the amount of nitric oxide our bodies can produce. Without enough nitric oxide, those blood vessels can't open wide enough, and the result is poor blood flow exactly where it's needed most. But blood flow is only one piece of the puzzle. Testosterone, the male hormone often called the fuel for desire, naturally declines as we age. Lower testosterone can reduce sexual desire, limit energy, and even affect mood and sleep. It's not uncommon for men in their 60s or 70s to experience a gradual decline that makes intimacy feel like more of a challenge than it once was. Medications can also quietly contribute. Blood pressure drugs, antidepressants, and even medications for prostate issues often have sexual side effects. While these drugs may be essential for overall health, they sometimes interfere with nerve signals or circulation, making it harder to achieve or maintain an erection. Then there's the emotional side. Anxiety, performance pressure, and relationship stress create a vicious cycle. Worrying about whether an erection will occur can actually prevent one from happening. The brain's anxiety centers interfere with the relaxation response necessary for sexual arousal. This is something I see every day in my clinic, and it's far more common than most men are willing to admit. Even chronic conditions like diabetes add another layer. High blood sugar levels damage both small blood vessels and nerves, impairing the very systems responsible for sexual function. In fact, men with diabetes are nearly 3 times more likely to experience erectile dysfunction compared to men without it. It's important to understand that erectile dysfunction is rarely caused by a single issue. It's usually the result of multiple small changes accumulating over time. What's crucial is recognizing that these are physical processes, not a reflection of masculinity or vitality. And just as these processes developed over time, there are also gentle, effective ways to support the body in restoring function, without resorting to harsh medications. In a moment, I'll share some of the most powerful natural oils that support circulation, hormone balance, and vascular health, offering safe, science-based support for erectile function, even after 60. The role of circulation and blood flow. If we want to truly understand how to reverse erectile dysfunction naturally, we have to go right to the root, circulation. Because at its core, erectile function is a matter of blood flow. Without strong, healthy circulation, even the most powerful medications or supplements will struggle to make a difference. Picture your arteries like flexible garden hoses. When we're young, those hoses are soft, elastic, and wide open. Blood flows effortlessly to every part of the body, including the penis. But as we age, those arteries begin to stiffen and narrow. Small plaques can form along the walls from cholesterol deposits, inflammation, or years of elevated blood pressure. This process is called atherosclerosis, and it silently reduces the amount of blood that can flow freely. For an erection to occur, those blood vessels must rapidly expand. The arteries leading into the penis, called the penile arteries, are some of the smallest in the entire body. Even tiny amounts of plaque buildup here can have a profound effect. In fact, in many cases, erectile dysfunction is one of the very first warning signs of cardiovascular disease, often appearing years before a man experiences any chest pain or heart symptoms. This is why I often say to my patients, your penis can be a window into your vascular health. But there's more to circulation than just the arteries. The tiny veins that carry blood away must also function properly. If the veins leak, blood won't stay trapped in the penis long enough to maintain an erection. This condition, known as venous leak, becomes more common with aging tissues and weakened muscles at the base of the pelvis. Nitric oxide, which I mentioned earlier, plays a crucial role here as well. It not only helps the arteries open, but also relaxes the smooth muscles inside the penile tissue itself, allowing it to expand fully. Without enough nitric oxide, even if the arteries are somewhat open, the erection may still be weak or short-lived. And nitric oxide production declines naturally with age. Factors like poor diet, lack of exercise, and oxidative stress all accelerate this decline. That's where natural interventions like certain oils and nutrients can make a real difference by supporting nitric oxide production, reducing inflammation, and improving endothelial function. It's not just about sexual health either. Improving circulation benefits the entire body, from the brain to the heart, to the legs, and of course, to sexual performance. When you support your circulation, you're investing in your total well-being. In just a moment, I'll walk you through some of the most effective natural oils that support healthy circulation and may help reverse erectile dysfunction, safely and gently, right from nature itself. The top natural oils that support ED. Now let's talk about what nature has provided, specific oils that support the very systems responsible for healthy sexual function. These oils don't just mask symptoms. They work with the body, addressing circulation, inflammation, hormone balance, and even oxidative stress, the real underlying drivers of erectile dysfunction after 60. Let's begin with one of the most researched, olive oil. Extra virgin olive oil is rich in monounsaturated fats and powerful antioxidants called polyphenols. Multiple studies, including work from the University of Athens, have shown that regular consumption of olive oil may support testosterone levels, reduce oxidative stress, and improve endothelial function. In other words, it helps the blood vessels relax and function like they did years earlier. The Mediterranean diet, which emphasizes olive oil, has consistently been associated with better erectile function in older men. A simple drizzle over your daily meals can deliver remarkable cardiovascular and sexual health benefits. Next is pumpkin seed oil. Often overlooked, pumpkin seed oil is particularly valuable for men over 60 because of its effects on the prostate. A healthy prostate directly supports urinary and sexual function. Rich in zinc, phytosterols, and essential fatty acids, pumpkin seed oil may help reduce inflammation in the prostate gland, lower dihydrotestosterone levels, and ease urinary flow, all of which contribute indirectly to improved sexual performance. Pomegranate seed oil deserves special mention as well. This oil is packed with antioxidants known as punicalagins. Studies have shown that pomegranate compounds can enhance nitric oxide production, improve arterial flexibility, and reduce plaque formation. In clinical trials, men who consumed pomegranate extract experienced improved erection quality and increased satisfaction. The antioxidant power of pomegranate works almost like a shield, protecting blood vessels from ongoing damage. Then we have ginger oil. Ginger has been used for centuries in traditional medicine, and modern research is catching up. Ginger contains gingerols and shagules, compounds known to reduce oxidative stress, lower blood sugar, and support vascular health. By improving blood circulation and reducing systemic inflammation, ginger may offer indirect but meaningful benefits for erectile function, especially in men dealing with metabolic issues like prediabetes or insulin resistance. Finally, cinnamon bark oil, when used carefully, may offer additional support. Emerging studies suggest that cinnamon can help regulate blood sugar levels, improve insulin sensitivity, and reduce vascular inflammation. Since high blood sugar damages blood vessels and impairs nitric oxide function, controlling these levels with natural compounds like cinnamon may contribute to better sexual performance. Each of these oils works in a slightly different way, but together, they support the multiple systems involved in healthy erectile function: circulation, hormones, inflammation, and vascular health. What makes them so appealing is their safety profile. Unlike pharmaceuticals that force the body into short-term responses, these oils nourish the body over time, allowing natural processes to rebuild and strengthen. In a moment, I'll show you exactly how to use these oils safely and effectively, whether through diet, supplements, or topical applications, so you can begin supporting your body without the risks associated with harsh medications. How to use these oils safely. Knowing which oils can support erectile function is only half the equation. The next question I hear most often is, how do you actually use them safely? Because while these natural options offer real benefits, improper use can lead to disappointment or even harm. Let's start with the most straightforward method: culinary use. This is where oils like extra virgin olive oil, pumpkin seed oil, and pomegranate seed oil shine. These are food-grade oils meant to be part of your daily meals. A tablespoon of extra virgin olive oil drizzled over a salad or vegetables not only enhances flavor, but delivers a rich supply of heart-healthy fats and antioxidants. The same goes for pumpkin seed oil. 1 to 2 teaspoons added to smoothies, yogurt, or soups can provide zinc, phytosterols, and anti-inflammatory compounds without any significant risk of side effects. Pomegranate seed oil, while slightly less common in kitchens, is available as a cold-pressed oil that can also be used in small amounts over food or taken as a dietary supplement in capsule form. Many patients find that incorporating these oils directly into their meals makes it easy to stay consistent, and consistency is key. These oils work gradually by supporting your body's natural systems over weeks and months, not overnight. Now let's talk briefly about essential oils, such as ginger oil and cinnamon bark oil. These oils are far more concentrated and require careful handling. Essential oils are never meant to be ingested directly unless under the guidance of a qualified healthcare professional trained in aromatherapy. They are, however, often used topically when properly diluted. For safe topical application, essential oils should always be mixed with a carrier oil, such as coconut oil, jojoba oil, or almond oil. A safe dilution ratio is typically 1 to 2 drops of essential oil per teaspoon of carrier oil. Applying this mixture to areas like the inner thighs, lower abdomen, or lower back allows absorption through the skin, potentially supporting circulation and relaxation without overwhelming the body. Always test a small patch of skin first to rule out any allergic reactions or sensitivities. There are also high-quality supplements that combine some of these oils into easy-to-use capsules, offering a convenient option for those who prefer a simple daily regimen. When choosing supplements, it's essential to select reputable brands that provide third-party testing to ensure purity and potency. The supplement market is not as tightly regulated as pharmaceuticals, so this extra layer of quality control matters. Regardless of how you use these oils, remember this: natural therapies work best when combined with an overall lifestyle that supports vascular health. Without attention to diet, physical activity, sleep, and stress, even the best natural remedies will offer limited results. In just a moment, I'll share the simple lifestyle changes that amplify the effects of these oils. Changes that can help you reclaim not only sexual function, but your overall vitality as you age. Supporting lifestyle changes that amplify the effects. Natural oils can provide powerful support, but if you truly want to restore healthy erectile function after 60, you have to build the right foundation. That foundation is your daily lifestyle. The good news is that even small changes can create a noticeable difference, often within a few months. Let's begin with physical activity. Nothing improves circulation like movement. When you walk, swim, cycle, or do light strength training, you're training your blood vessels to stay flexible and responsive. Even a simple 30-minute walk 5 times a week has been shown to improve endothelial function, the very lining of the blood vessels responsible for blood flow to the penis. Studies published in the Journal of Sexual Medicine confirm that moderate physical activity can reduce the risk of erectile dysfunction by up to 70% in older men. Next is weight management. Carrying excess weight, particularly around the abdomen, directly affects hormone levels. Fat cells produce a substance called aromatase, which converts testosterone into estrogen. As a result, men with more abdominal fat often have lower testosterone levels, further compromising sexual desire and performance. Losing even 5 to 10% of body weight can rebalance hormones, improve blood sugar control, and ease the physical strain on blood vessels. Blood sugar control is another critical piece. High blood sugar damages the delicate inner walls of arteries and reduces nitric oxide production. For men with diabetes or prediabetes, managing carbohydrate intake, choosing whole, unprocessed foods, and maintaining stable blood sugar levels can have a profound impact on erectile function. This is another area where oils like olive, pumpkin seed, and cinnamon bark may offer added benefits through their effects on insulin sensitivity and inflammation. Sleep is often underestimated but absolutely vital. During deep sleep, the body repairs damaged tissues, regulates hormones, and produces most of its daily supply of testosterone. Poor sleep quality or sleep apnea can dramatically lower testosterone levels and increase the risk of erectile dysfunction. If you struggle with snoring, daytime fatigue, or restless nights, addressing sleep quality should be a top priority, often leading to significant improvements in sexual health. Chronic stress also takes a heavy toll. Ongoing anxiety activates the body's fight-or-flight system, releasing cortisol and constricting blood vessels. Over time, this reduces both desire and performance. Simple stress reduction techniques like meditation, breathing exercises, and mindfulness can quiet the nervous system, allowing the body's natural arousal pathways to function more easily. Some men also benefit from counseling or therapy, especially if performance anxiety or relationship concerns are part of the picture. Lastly, limit tobacco and alcohol. Smoking directly damages blood vessels and accelerates arterial stiffness, while excessive alcohol impairs liver function, hormone production, and nerve signaling. Quitting smoking and moderating alcohol intake can often produce measurable improvements in both circulation and erectile strength within months. These lifestyle changes don't require perfection. What matters is consistency and small, sustainable steps. Combined with the natural oils we've discussed, they can work together to restore balance, strengthen circulation, and support sexual vitality, even well into your 60s, 70s, and beyond. In just a moment, I'll share a few important warnings, situations where erectile dysfunction may be a sign of something more serious, and when it's critical to seek professional care. Warnings and when to see a doctor. While natural oils and healthy lifestyle changes offer real hope, we also need to talk openly about when erectile dysfunction may be signaling something far more important, and when professional care becomes absolutely necessary. The reality is that erectile dysfunction is often one of the very first signs of hidden vascular disease. In fact, research published in the American Journal of Cardiology has shown that men who develop erectile dysfunction often experience heart problems within 3 to 5 years if underlying issues aren't addressed. That's because the arteries supplying blood to the penis are smaller than those leading to the heart. If blood flow is being restricted in one area, it's very possible that the larger arteries are also starting to narrow. That's why any man, especially over 60, who suddenly develops erectile difficulties should consider it a warning sign, not simply a normal part of aging. Sudden onset, rather than a slow, gradual change, can point to more acute problems like significant arterial blockages or even early-stage heart disease. Other medical conditions can also contribute. Diabetes, high blood pressure, high cholesterol, and hormonal imbalances often combine to affect both circulation and nerve function. In these cases, managing the underlying condition can sometimes restore erectile function on its own. But this requires medical testing, blood work, hormone panels, cardiovascular screening to fully understand what's happening beneath the surface. Nerve-related issues are another consideration. If erectile dysfunction is accompanied by numbness, tingling, or weakness in the legs, this could suggest problems with the spinal cord, nerve compression, or diabetic neuropathy, all of which require medical evaluation. Prostate health also plays a role. Men who experience urinary difficulties, pelvic discomfort, or changes in ejaculation along with erectile dysfunction may be dealing with benign prostatic hyperplasia, prostatitis, or in rare cases, prostate cancer. Again, these conditions are highly treatable when caught early, but require prompt professional attention. Medications, too, should be reviewed carefully. Blood pressure drugs, antidepressants, certain antihistamines, and medications for prostate health can all have sexual side effects. If you suspect your medication may be contributing, don't stop taking it abruptly. Instead, speak with your healthcare provider about potential alternatives or adjustments. And finally, the emotional and psychological component should never be underestimated. For many men, especially those in long-term relationships, stress, performance anxiety, or changes in intimacy can create a powerful feedback loop where anxiety itself becomes the primary cause of dysfunction. In these cases, counseling, open communication with a partner, and sometimes professional therapy can make a tremendous difference. The key takeaway is this: while natural oils and lifestyle improvements are valuable, they should never replace proper medical care when warning signs are present. Erectile dysfunction is often not just a sexual issue, it's a full-body health issue. Ignoring the signals can allow silent conditions to progress, while early intervention can prevent far more serious outcomes. In a moment, I'll leave you with some final thoughts and a reminder that aging doesn't mean losing vitality. There are safe, natural, and effective ways to support your body, stay independent, and continue living a vibrant, fulfilling life. Erectile dysfunction after 60 is not the end of intimacy, confidence, or joy. It's a signal, your body's way of asking for attention, care, and adjustment. The truth is, many of the systems involved in sexual function remain fully capable even as we age, provided we give them the right support. We've covered how healthy circulation, balanced hormones, reduced inflammation, and restored nerve function all work together. The oils we discussed, olive oil, pumpkin seed oil, pomegranate seed oil, ginger oil, and cinnamon bark oil, offer targeted, natural ways to nourish these systems. They're not magic, but when used correctly and combined with consistent lifestyle changes, they can help reverse much of the decline that many assume is simply part of growing older. The encouraging news is that the body is remarkably resilient. With small, steady changes, a daily walk, better sleep, weight loss, stress management, you may start noticing improvements not only in sexual performance, but in overall well-being, energy, and confidence. In my years of practice, I've seen men in their 60s, 70s, and even 80s experience meaningful improvements simply because they committed to caring for their health holistically. But always remember, there's no shame in seeking professional help. Addressing underlying medical conditions, reviewing medications, and having open conversations with your doctor are essential steps. You are not weak for asking questions. You are wise for taking responsibility for your health. Aging is not about losing power. It's about learning how to live in partnership with your body as it changes. There is a quiet strength in recognizing that you deserve intimacy, vitality, and happiness at every stage of life. These years can be filled with connection, joy, and even a renewed sense of purpose. If today's information helped you, I encourage you to stay connected. There's much more to explore, from natural ways to boost testosterone, to simple exercises that enhance circulation, to foods that directly support vascular health. Subscribe to the channel so you don't miss the next conversation. And if you have questions, share them in the comments. Many others are walking this same path, and together we can continue learning how to glow brighter, even as the years move forward. Because aging, my friends, is not about fading away. It's about finding new ways to thrive.